YouTube. Do you like to dance, but you don't want to break a bone? All right, let's talk about osteoporosis and hormone replacement therapy. That's the topic for today. So, if you're new here, I'm Dr. 𝐤𝐤𝐤𝐞. I'm the internal medicine doctor here at Angelic Wellness. I just wanted to talk to you guys really quick about bone loss as we age and how hormones might be related to the cause. As we all know, a lot of patients at a certain age get diagnosed with osteopenia, osteoporosis, depending on how serious the bone loss is. And the way we find out patients have this issue is that at a certain age, usually starting around age 40, we start to do a screening test called DEXA scan. That is the DEXA. And the DEXA scan is the gold standard kind of like test that we use to measure how thick your bone is compared to your age standard, right? So meaning like other women or other men that are your age, that are in good health, how strong is their bone compared to yours, okay? So we have this Z-score that we've established that we go by. Like if you're this many standard deviation away from that, what's considered normal, then you're considered to have a thinning bone, which we call osteopenia, or really thinned bone, which we call osteoporosis, okay? That means that there's a lot of pores in the matrix of your bone, and that's where the name comes from. And that means that you are at high risk for a spontaneous fracture. Like you might just be dancing and you break the hip, or you break the pelvis, okay? So those are very serious because this actually has caused the death of a lot of patients. Because remember, within the matrix of your bone is actually where red blood cells are made. A lot of cells actually, not just red blood cells. The bone marrow, right? You've heard of bone marrow. Yes, a lot of blood is made from there. And when you fracture a bone spontaneously like that, well, guess what's going to happen? There's going to be clots, there's going to be things thrown in the wrong direction. Of course, there's pain, and then there's also, healing. Maybe you fell and hit something else and broke something else. So this is one of the number one things that cause patients to actually end up in nursing homes, is this bone fracture. So we know this is a very serious problem, and how do we prevent it? So a lot of people talk about, okay, when you're growing, you drink milk and you eat things that have a lot of vitamin D and calcium in it so that you can have strong bone. That's good when you're growing, okay? So what happens when you've reached that age where you're no longer growing? Like, that advanced maternal age that we've talked about multiple times on this channel, or for the men, andropause, when you get to the point where you are not making enough testosterone anymore. What happens to your bone at that point? So what the studies are showing is that losing your hormones actually also does affect the rate at which you lose your bone. A lot of people don't realize that vitamin D itself, besides being a vitamin, is actually also a hormone. And it's very important in the building of bone, in the balancing of other hormones that actually also help encourage bone strength. So a lot of patients, once they've been diagnosed with having this osteopenia or osteoporosis, are put on medications that actually are supposed to help strengthen their bone. And I put that in quotations because it is kind of like a band-aid. Because what these medications are doing, they are not actually strengthening the matrix of your bone. They just make the outer layer of your bone harder. But when the inner matrix is still weak, then fractures can still happen. So it's a band-aid, it's not the solution. So what I encourage my patients to do instead is, look, why don't young people break their bone? Well, because their hormones are optimal, right? They have all of the hormones that is needed to keep that bone strong. Okay, so when you get to the age where your hormones are dwindling and you're losing almost everything, well, your bone dissolves with it. So if we want to get the matrix of your bone back to healthy strength, we have to replace your hormones. So when we actually compared studies that looked at patients that were on medications that supposed to make your bone stronger, and patients that decided not to take those but just replace their hormones, we're seeing that the bone in the patients that replace their hormones are recovering at a faster rate. And the whole matrix is stronger, not just the outer layer as in the drugs that are supposed to make your bone stronger. So we do DEXA scan on these patients and we're seeing improvement year over year on the patients that are on hormone replacement, whereas the ones that are on this prescription drug that just pretends to make your bone stronger, their matrix are still weak. So which one would you rather have? A truly stronger, healthier bone like the one you used to have, or the one that's pretending to be stronger but still puts you at risk? And to make matters worse, a lot of these medications actually also give you other problems, such as spontaneous necrosis of other bones in your body. So would you rather have that, or would you rather have your hormones, your natural hormones that's helping you with 100 other things, help you strengthen your own bone? Please comment in the section below, which option would you like? Okay, so medications like alendronate or hormone replacement therapy. Okay? Let me hear what your answers are below. I'll see you on the next one.